Today we have with us Dr. Raz, who is our lead interpreting physician, and he is going to bust some myths about mammograms, breast cancer, and what actually causes breast cancer and what doesn't. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Dr. Raz, thank you so much for being with us today, and you know you're one of our favorite guests, and I promise not to get into an argument with you today.
It's always fun to be here, Dorothy.
Thank you. So explain your role here at The Rose.
Yes, I'm the chief radiologist here. That means that I'm the one who reads a lot of studies and also am the one who sets the protocols. Mm-hmm. So anything new that comes up, new technology or new way to screen or diagnose breast cancer, I'm the one who's responsible to implement it. Mm-hmm. So, for example, we had MRI, and the next up is MRI biopsy, so I'll be the one spearheading that. So I'm the lead interpreting physician and love to do what I do here at The Rose.
And we love having you. Your patients love having you.
Thank you.
So today we want to do something a little different.
Okay.
And some of these myths that we have about mammograms, about breast cancer, about early detection,
right,
have been around a long time.
You look fabulous.
Oh, thank you. Thank you. But I think that was directed to me directly because I could remember that when they first came out. But seriously, right now, Freddie just sent me something on Instagram that's going around, thousands
mm-hmm.
of comments saying, well, they keep telling you mammograms are good for early prevention,
mm-hmm.
and for early detection,
mm-hmm.
but that very machine could give you cancer.
Right. So I think the crux of that is that a lot of people think that radiation from mammogram can cause the very thing it's trying to find or screen for, which is cancer. So just straight numbers, every American just living here for 1 year, we all get 3 millisieverts of radiation. Now, you don't have to remember the units, but it's a unit of radiation.
Okay.
How we measure ourselves in pounds and distance in feet.
Okay.
The measurement of radiation exposure here is millisieverts. You may forget that, but remember we get 3 millisieverts. If you get a mammogram, maximum you get 1 millisievert. Usually it's between 0.5 to 1, depending on the number of images we do. So all of us, even if we weren't to do screening mammogram, receive 3 mammograms a year. So it's very low radiation.
Right.
So this amount of low radiation, the amount of risk and reward that we measure, we have to weigh, it's completely worth it screening for cancer with this amount of low radiation. If you fly from here to San Francisco, come back, you also receive around 1 or 2 millisieverts worth of radiation. So just taking flights will give you that much cosmic background radiation, and just living here on Earth for 1 year will give you that much, 3 times as much radiation as a mammogram. So absolutely not. I think this sort of thing gets propagated because, well, it is X-ray. It is penetrating, energy, electromagnetic wave, but we need that so we can see inside the breast. But no, it's not energetic enough to cause DNA displacement and cause cancer. There's been no studies proving that.
Yeah.
So yeah.
I think it's always interesting how that conversation almost automatically goes to, and look at how much money those radiologists make. And look at how they're promoting this. There's not another, and I truly believe this, I've always believed this, this is a women's problem, a women's
right.
It's always going to be exaggerated in some way. There's, if you have heart disease, we don't sit there going, look at all the money those cardiologists are making.
Right, that's a great point.
It's like, what is the difference here? Is it because it's primarily for women? Is it because it was something that said we might find a way to keep you from dying? Is it because it was so, just unique and new? And What is it that is that driving force around that?
I think the controversy comes from the fact that we do not have many national screening programs, and many countries don't. A lot of Western world has. Mm-hmm. One of them is breast cancer screening. Mm-hmm. The other big one that we have is colonoscopy. Now, if we were doing colonoscopies every year, we'll have the same controversy there. We don't, thankfully.
Yeah.
You do it every 10 years. Mm-hmm. And that's, we've studied it, and FDA and all National Cancer Institute and all these big bodies have decided that 10 years is sufficient. There's some nuances to it based on risk. You do every 5 years, ulcerative colitis, etc.
Right.
But that's the thing. Mammograms every year, which is about the only screening nationally recognized and done program that does this, like 1 year screening every year, right? We sort of had, if you search Instagram long enough, flu shots, same thing. People will come up with lots of things. Oh, I took flu shot, didn't do anything. We should stop, ban flu shots, et cetera, et cetera. Right. Vaccines, we have similar controversies because they do it every year. Mammogram suffers from the same thing where you're screening every year. Since you're screening every year, and there are lots of women, all of this controversy comes, right? So that's what it is. Partly that's the reason. The other reason is breast cancer is actually like top 3, like in terms of, killer cancer, right? So the number 1 is lung cancer in the United States between both sexes. After that, it's colon cancer. And then after that, it's breast cancer for women. For men, it's prostate cancer. Unfortunately, there's no screening for prostate cancer. Also, but this part is fortunate, a lot of men die from other causes, like heart disease, other things, than prostate cancer. And prostate cancer tends to be not very aggressive, majority of the kind.
Right.
Unfortunately, breast cancer is not just one disease. It's very different. So that's also playing into like a lot of these controversies. But I do believe it's because it's a national program is done every year. It
has nothing to do with being part of women's health.
It has. It also is that's also a fact, right? Because it's a woman thing. And then remember, before 1970s, 80s, nobody really cared. We didn't have anything. We didn't have any screening programs. Right. It's and so as we've advanced and this all gets into politics and women's rights and everything, this is all amalgamated into this one focal point. And then, yes, there are lots of people who just talk a lot and slinging mud at this.
And this was one of the first myths that we had to overcome in the beginning.
Right.
I mean, we're talking 40 years.
Yeah,
plus.
40 years, yes.
Yeah, and it's still out there.
It's still out there despite very hard and strong evidence that is because of national screening program, or being an advocate, pick the rose, or that we've had like decreased in terms of like disease burden. Now, incidence is unfortunately still high, but the disease burden, like the deaths, it has been on the downward trend because you're catching it early. You get rid of screening. Let's say you start doing every 2 years. I guarantee you, a lot of these deaths that we've been preventing is going to start going up.
We saw that when they changed the recommendations.
Exactly.
Remember, it was only like 4 years, and all of a sudden you started seeing that increase.
Exactly.
Yeah. So
despite this hard evidence, people talk a lot about this.
People talk a lot.
So,
all right, let's go to the next one. And maybe you have another one that's more important. But to me, it is that one about, well, I don't have family history. Why do I even have to worry about it?
Right. Great question. So, unfortunately, majority of breast cancer, only about 10 to 15% is genetic based.
That the woman even knows about.
Correct.
Yes.
Majority of breast cancer, we use the word acquired, meaning you just get it. Just being a woman and as you age, those are the two biggest factors. You can get breast cancer. So statistics, pretty much everybody on this podcast, but I've memorized by now, but 1 in 8 women will get breast cancer during their lifetime. We define lifetime roughly as around 85 to 90 years old in the United States. Again, breast cancer is not one disease. It's multitude of different types of cancers or diseases, if you want to call it. So, yes, it's, because of this incidence, 1 in 8, it's important to screen. I cannot stress this enough.
Yeah. Family history
and
or
family
not.
history is just but one part. If you do not have family history, you're still at risk of developing breast cancer because majority of breast cancer, as I said, is acquired. It's not genetic abnormality causing it.
Okay.
Unfortunately, the risks are many. There are environmental factors. There are certain genetic factors. Obviously, genetic abnormality like BRCA mutation is what we're talking about here, can increase your risk. BRCA, one mutation has like 80% risk. So very high, guaranteed almost breast cancer. But that's not majority of breast cancer. Small percentage of breast cancers that we find. Just being a woman and your age gives you the highest risk. Then obviously there are family history outside of genetic factors.
Right.
But then your breast density, the way you eat actually, obesity, all these things, environmental factors, they all play a role.
Yeah.
It's not just genetics. It's not just DNA or gene abnormality.
Okay, touch upon, and yes, we all know it's the older woman's disease.
Yes.
But
younger women can also get it. Yes.
Right. So we don't want to ever say this is just for that older women need to be concerned. Younger women are diagnosed with
correct.
breast
So like
cancer.
around 10 to 15% of women that we diagnose with breast cancer, they're actually under 40. Mm-hmm. So that's a significant amount.
Yeah.
So 100 women with breast cancer, 15 are under 40. Under 40 is young. Mm-hmm. And some studies will say between like under 45. But bottom line, younger women, premenopausal women. So no, it's absolutely not just an older woman's disease. No.
And one time, and we're going to get back to the current myths also, but one time you pointed out that younger woman loses more years of life.
That's right.
When it's not detected, not treated, or not successful in treating.
Right. So, number of years lived, and there are many versions of this, or number of year lives saved is what we use in papers. But what it means is that if we treat the disease, how many more years can a woman live? Right. So if it's a younger woman, obviously she has much longer to live. You change the course of her life. Mm-hmm. And actually, this goes back to the first point you made, is because it's a woman's disease, woman really is, and we're not going to 1950s like the old family, nucleus thing, but still, a lot of I see this, and you can call it anecdotal, but I meet plenty of women that skip screening mammogram. Their reason is because I was too busy, because I didn't have time for myself. I was taking care of my family, taking care of my kids. I was working a job, helping my husband, etc. It really changes the whole, messes up with the whole family, if you want to call that. If a woman doesn't take care of her health, her kids suffer, family suffers, everybody suffers. That's one of the other reasons it's so much in focus, the first question you're asking me about the controversy. But yeah, bottom line, it's something that's still underappreciated, the screening mammogram. I don't know why that is, but every year, October, that's why we dedicate so much time to it. Mm-hmm. But it's unequivocal. There's no controversy here. Got to get screening mammograms in.
All right. So now let's go to some of those that I've heard all my life.
Sure.
Are, wearing an underwire bra, wearing a bra at night, wearing a bra period causes breast cancer.
Right. So I think this is there was an old study in 1980s, 1990s. Somebody studied with the underwire bra. And what ends up happening is if you wear underwire bra, there's lymphatics in the breast tissue. Their job is to clean, it's like garbage cleaning. Think of it that way. And, underwire bra can prevent it from happening, but there's no link between wearing a bra, not wearing a bra, and causing cancer. None. Not wearing bra isn't going to prevent cancer. Wearing underwire bra is not going to cause any breast cancer. But it can cause breast pain because then those lymphatics can't clean up as efficiently and you retain some fluid, causes swelling, could cause some cellulitis, some breast pain. So that's really about it. They've done multiple studies on this. No direct connection to breast cancer.
Deodorant.
Okay, great. So deodorant, I think the element in there that's the most controversial is aluminum. So again, NCI and FDA have studied it actually in case control studies, and they've tried to figure out, hey, how much aluminum does one absorb in the skin? It's very minimum. And even whatever amount gets absorbed doesn't get to cells or penetrate into cells. So no connection has been found between aluminum causing direct breast cancer or cancer. Okay. So deodorant, no, don't worry about it. They've done case control studies. Nobody has done cohort studies, but no direct correlation with breast cancer. I mean, causation with breast cancer. So please put on deodorant.
All right. What about cell phones and carrying your cell phone in your bra? Now, I know that sounds weird to some of our listeners, but it's a logical place.
Right.
If you're not carrying a purse or whatever.
Right. My grandmother actually, I remember she used to carry her small wallet in her bra. She used to take out the wallet from her bra. I'd say that's very uncomfortable to carry it, but if you are, cell phone, they're radio frequency, so they're very low energy electromagnetic waves. Okay. So these are big words, but we're all surrounded by energy. The light in front of my face, that's also energy. It's not causing me cancer because it's low energy. Cell phones the same way. These are low energy, and more so than breast cancer. Think about it. We're always using it on our head.
Right.
People have studied it for neurological disease or brain-based cancer, brain cancer.
Is there anything to that?
There's been no connection. Okay. It's just not strong enough. Now, compared to one of the first questions we asked about mammogram, remember causing... Now, X-rays are higher energy because we need that high energy to actually penetrate the tissue. But again, they're not high energy enough to cause cancer. Right. So definitely cell phone signals and cell phone is not.
All right. There's a lot of these. What about dyeing one's hair?
Dyeing one's hair, again, it's sort of similar to antiperspirants or deodorant. The chemicals, and I think a lot of talk about parabens and usage of that. But again, while these are found to be caustic on a preclinical data, meaning like in lab, no connection has been found for causing breast cancer. Again, we're looking for causation.
Okay.
So none. So if you feel like you need a hair color, please dye your hair.
Is that kind of the same as the water bottles? Or is that a different? If you use...
plastic?
Yes, the plastic water bottles.
So again, it's... it has to do with the fact that a lot of these are plastic and can cause inflammatory conditions in our body. Actually, one of the topics that's relevant in breast imaging is silicone implants. Right? Silicone implants back in the day, what would they do? Could they cause... And there's actually an active study that's happening for inflammatory condition being caused by silicone implants. Now, the old implants, there's some correlation, not causation found. Okay. That's still been happening. So meaning like joint pain, lymph nodes getting swollen. So a lot of women have come out and said, this, I'm talking about 1980s, 1990s.
Right.
So sort of inflammatory conditions can happen, if you use chemicals, right? This is why there's this whole talk about, eating healthy, organic food, right?
Right.
It's because whatever we ingest can cause some reaction, inflammatory reaction from our body. But is it leading to cancer? No.
Okay.
Yeah.
Hormones.
Okay, so hormones, HRT in particular, right? Now, that does increase your risk of breast cancer, hormone replacement therapy. So
if you're using both estrogen and progesterone?
So estrogen is the main culprit.
Okay.
Now, remember why we do HRT is, when a woman hits menopause, there's severe symptoms some women feel, right? So headache, brittle hair, mood swings, headache. And those are affecting quality of life. So a lot of OBGYNs do start on HRT, but again, they will not be keeping you on it forever.
Okay.
So they taper you off when your symptoms become more under control. You've hit menopause and you kind of get in control of all these symptoms. They taper you off. If you're permanently going to stay on HRT, that does increase your risk of two cancers. One is breast cancer, then one is uterine cancer. And again, why? Because HRT are estrogen analogs. And remember, one of the medications that we use to treat breast cancer is, tamoxifen or aromatase. These are anti-estrogen. So they actually block the effect of estrogen because cancer cells love estrogen. The more they get, certain cancer cells. So again, you can think of estrogen in postmenopausal women as a detrimental force, and you do not want to be staying it on too long. But again, OBGYNs are very smart, and they taper you off. They don't keep you for many years. And again, it's an accumulative effect. So you don't just take it, you have risk. You keep taking it as when the risk accumulates, if you will.
Of course, there's some menopausal symptoms that you don't want to go through.
Right.
And it, I said I wasn't going to get into any arguments, but it's amazing to me that we can find medicines and therapies for men.
Right.
But we have yet
women.
to find anything for menopause.
Right.
We have yet. I don't care. The same things they're recommending right now, we recommended 20 years ago.
Right.
There is no relief.
Right.
And yet we're supposed to act normal when we're going through
I feel
that.
you, which is why a lot of patients come in, they tell me, should I stop? I say no. Just talk with the OBGYN, continue on HRT, just monitor it, and then taper off. I wouldn't want any woman to go through like terrible menopause symptoms. So like they do ask me, like I've heard it causes cancer. It doesn't cause cancer. It increases your risk for breast cancer.
Right.
So be on it. Symptoms are severe. You don't want to live with, a horrible experience, horrible life.
Right.
But it does, there is science behind that. It increases risk, unfortunately. Okay. Yeah.
So surveillance, monitoring, all
Correct.
of that.
Monitoring. Yeah, that's right. Doesn't mean you don't take it, but just watch it.
So does soy fall in that same hormonal?
No, I haven't read much about soy. To my knowledge, it hasn't shown any direct causation to breast cancer.
Right.
But again, because it modulates your internal hormones, I believe that's one of the topics with soy.
Yeah. Too much caffeine?
So too much caffeine can cause breast pain. But again, does not cause breast cancer. If you injure your breast, again, does not lead to breast cancer. What ends up happening is when you injure your breast, you come for breast screening. Hey, I injured it. I feel a lump. Because one of the ways that breast heals is it can cause hematoma. So if I slam my hand really hard against the door, I'll cause some bruising.
Right.
That bruising gets resolved, but because a lot of breast tissue is made of fat heals itself in a peculiar way. It's called fat necrosis. Again, it's a fancy word you don't have to remember, but occasionally it can form a mass or a cyst. It's called an oil cyst, right? And that's how fat heals, but it can feel like a mass. And body can deposit some calcium in there. And calcium's hard, so you can feel a hard mass. Now that happens, so everybody freaks out. Obviously, they come in and be like, hey, it's a mass, it's cancer. But it's really fat necrosis, which is a benign thing. It's just how fat heals from trauma. And trauma doesn't even have to be like an accident. It could just be from surgery, too.
Oh.
Yeah, so surgery is man-made trauma or
Right.
woman-made trauma. When you're doing breast lift or breast reduction or implants, these breasts can have calcification. They can feel like masses. But again, I'm going to put an umbrella term and call it trauma. If you had trauma or injury to breast, doesn't mean you'll get breast cancer. In fact, there is no causation to breast cancer. But because you feel that mass, you come in and we may find breast cancer. Right. That's why these are sort of anecdotes come on Instagram. Like, hey, I injured my breast, turned into cancer. It for sure wasn't the injury that caused the breast cancer, but you came in and we found breast cancer.
Right.
Does that make sense?
Yeah. Yeah. Animals can sense breast cancer.
I mean, if animals can sense breast cancer, I suggest we stop compressing the breast and doing mammograms. We'll just get
Use
that animal.
I mean, there's been cases where someone says my dog kept pointing to this place on my breast.
We should bring the animal as an advocate on Breast Cancer Awareness Month, because that will, like that woman came in for breast screening and we probably found cancer as an anecdote. We'll get many more women together. But no, animals have no 10th, 6th, 7th, 8th ability to find breast cancer, see through you. There's no such thing. One other thing I wanted to cover is ivermectin or any kind of azole drug. These are used. I've seen Instagram posts on these. And again, these are anecdotes. People have found, I could say, and you can even look this up, bleach even cures cancer. I could make that statement. but it does so in a petri dish, in a preclinical, in a lab. See what I'm saying? Like,
But that's where so many things
exactly
can happen.
Right.
Yeah.
So one thing I want all the listeners to understand how a scientific method works, or how these medications come that we all use in U.S. or around the world. It's a very rigorous process. You try lots of compounds in preclinical data, in mice and everything. That's all preclinical, meaning in a lab setting. In the lab setting, yes, there have been some papers talking about ivermectin being helpful. But again, in the clinical setting, you go through phase 1, 2, 3 trial before you submit the drug to FDA. Phase 1, we check for if it's safe or not. Phase 2, we actually expand it and see if it's actually efficacious or not in a select group of people. And then phase 3 is when we do something called double-blind control trial. Now, it's a big word, but that's the gold standard of checking.
Go through that list again.
Right. So phases. Phase 1, we check if a drug is harmful to humans or not.
Okay.
So it's safety.
Okay.
So when the drugs make it through there, they go to phase 2. Now, within the same sort of small group, 300, 400 patients, is the drug in that for that given condition beneficial or not? Now, it proved itself in preclinical trials. Does it prove in human trial? Okay. So a lot of drugs fail here where they don't show any efficacy. Like, hey, it was great in the lab. Ivermectin was great there. Here, it kills people because it's actually used for deworming in livestock. So don't go out there consuming lots of ivermectin. And then phase 3 is where we do double-blind randomized control trial. What does that mean? These are usually giant trials. Many hospitals, many thousands of patients get involved. And there are control groups, meaning one group of patients are given the current medications, the other group's giving this new medications. And then the doctor doesn't know which one is going to. So the doctor's blind assigning these medications, and the patient doesn't know which one they're getting. And then we directly compare this medication to the gold standard to see how it does. Does it make sense? So it's a very rigorous way of proving that conclusively it does, it helps. Now, as I said, a lot of these ivermectin or fenbendazole type of medications, these are anecdotes. A lot of these patients probably are on chemotherapy, and then they tried ivermectin and it worked. Maybe there was some synergy, but it was the chemotherapy that did the work, not the ivermectin. Does that make sense? Then they came on and say, oh, it helped me. There have been no clinical trials proving any efficacy for it helping with breast cancer. So please consult with your doctor before trying anything that you hear on Instagram or anywhere on social media.
All right. The other one floating around today is about bee venom.
So
what is that?
There's a compound in it. I believe it's called melatonin. Now, again, in petri dish preclinical trials, lots of compounds show lots of promises. As I said, if you stick bleach into cancer cells, they'll all die. Doesn't mean I'm about to run out and drink the washer bleach. Again, these type of compounds, flower-based, venom-based, they show a lot of promise in preclinical. No studies have been done that have proven any efficacy on human trials. So again, somebody can rewind this podcast and listen to what I said about phase 1, phase 2, phase 3. We have to go through these processes before FDA approves that we've seen it. So no, it has not shown any clinical data on humans. And please don't go out there getting stung by bees. It's not going to help you.
All right. So one of the things that we often hear is I didn't trust my doctor. I didn't believe what the doctor was telling me. I didn't. Is that just as important to recovery as some of our meds?
Yes.
Trusting your doctor.
Trusting the process, believing in it. Yes, it's a big thing. And every time I give the cancer diagnosis to my patients, I verify and double check they have strong family support. All of this matters, right? And since we're going on the topic, a lot of patients also ask me, "What about diet?" And it helps. Right, obesity has shown correlation. Again, no direct causation to breast cancer, but correlation, and it will make sense. Like living healthy, having a stable emotional context, all of this helps because, again, as humans, we haven't figured out every nook and cranny of our genetics or molecular changes that happen in us daily.
Right.
being healthy is a very big thing in terms of mental health, emotional health, physical health. Believing in the process you're going through, very important. Again, because it's a mental thing. You do that, it does help. You're going to follow through on these tough protocols. And I don't make mincemeat about the fact that chemotherapy is tough. Every woman knows it. Everybody that's gone through cancer knows it.
Right.
But it's a necessary thing. It is poison. Even the oncologist will tell you. But it's poison to cancer cells as well, right? So job is to kill cancer. Unfortunately, you have to go through that process. A lot of patients talk about like Ayurvedic like process, other things outside of homeopathic medications. I have no issues with it. But if you're going to detract and not do standard protocols that have been tried on millions of patients that have all made recovery and are in remission, I think you're doing yourself a disservice. So it matters.
It matters.
Any other listener questions come in, I'm happy to answer.
Oh, yes. Yes, we would be happy. And we add them to our quarterly review of Myth Busters. Is that what we're calling
that's right.
this?
Let's call it.
All right. Thank you, Dr. Raz, for clearing up the air once again on what is true and what is not true. Great way for us to start 2026.
All right. Be healthy, everybody out there. Take care.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.